This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is Dr. Deepak Megur, and this is a dense cataract. And sometimes we may have a difficulty in separating the last few fibers of the leathery posterior plate in such brown cataracts. And if we encounter such a situation, how do you manage that? Let us learn about this situation through this case. Now, since it's a brown cataract, I would like to have a bigger axis. At the same time, we want to have a toric lens. So we don't want an extra large rhexis because we want some amount of capsulorhexis cover over the optic of the lens. So that's the reason why we need to find some compromise. Maybe 5 or a 5.5 millimeter well-centered rhexis would be ideal in such situations, but definitely not less than 5 millimeter. So the capsule is stained and the rhexis is performed. It looks to be appropriate. So these elderly patients can have compromised zonular health, especially with these brown cataracts. So we need to be very mindful of this. So I would want to do gentle hydrodissection so that the nucleus is well and truly free from the capsule bag. A small amount of fluid is injected under the capsule and the lens is tapped back. The nucleus is gently moved around and I'm fairly satisfied with the nucleus mobility, so it should be fine. The chamber is again pressurized with OVD and I'm using a sharp chopper just to rotate the nucleus a bit. It's a sort of a final confirmation that the bag is still not adherent to the nucleus. Now in this case, I'm going to do the classical 4-quadrant technique, wherein we're going to create 4 trenches, 90 degrees to each other, and then divide it and then consume it one by one. So once the superficial epinucleus is taken care of, now is the time to start the sculpting power. You can note the power which is set on the machine. It's 90% continuous torsional. The nucleus is stabilized with my second instrument and I'm going to create a long, thin trench. As we keep trenching, we can notice those horizontal striations. The nucleus is now rotated. Sculpting is done 90 degrees to the original groove. Care is to be taken when we're very near the rhexis margin. So most beginner surgeons are very scared to go near the rhexis margin, but if we can see well, really we can have a slightly longer trench under the rhexis as well. The nucleus is then rotated back to the original groove. The ultrasound energy is used to deepen the pre-existing groove. The nucleus is rotated and 90 degrees to the previous groove. Again, a fresh groove is created by sculpting. And as we see, progressive grooves are going to be deeper than the previous groove. The nucleus continues to rotate and I continue to do the sculpting. At no time can you notice that the nucleus is being pushed at or shooed at. You should be using just the energy of the phaco to melt the nucleus in front of it rather than mechanically pushing at it. So this is the most common mistake most beginner surgeons do when they're learning sculpting. So the nucleus is continuously rotated and the grooves are progressively deepened. At some stage, the horizontal striations which I was seeing have diminished now, at least in the central portion. And I feel this is now the right depth for me to attempt cracking. So I'm going to hold one of the fragments with the vacuum of the phaco tip and by burying it, and then I'm going to perform the lateral separation maneuvers. So holding one of the fragment with vacuum and pulling it up, it produces lesser stress on the bag during lateral separation maneuvers. So that's the idea here. The only problem with this situation is many times we may not have enough wall which is left to bury the phaco tip into it, as is happening in this case. So you don't get an support to bury it and then do the lateral separation maneuvers. The nucleus is rotated and the nucleus is lifted up, and you can see the last bit of fibers which are holding. I'm just trying to tease it out with my sharp chopper. The posterior capsule will be very thin and flimsy in such a dense nucleus. So you need to be as gentle as possible. So sometimes the posterior leather plate will be adamant on not giving way. So the only way out is to just hang in there and never be too rough. So always be as gentle as possible. This is the last groove which has to be separated. Now the separation is good all around except for the central portion. The central portion continues to be holding all these pieces together. A small chunk of the fourth quadrant comes out, which is then emulsified. And it is like now we are having a flower petal situation where the bottom is attached and the anterior portions of all the fragments are separated. I'm trying to be as deep as possible, but when you're stuck in such a situation, the best option always is to take out one fragment and then emulsify. However you can do, because the posterior aspect is still attached, but the anterior plate can be very well emulsified with ease. And what we'll be left with is the bridge which is connecting all these fragments together in the posterior part, that is the leathery part. And how are we going to deal with that part? I'm just going to demonstrate it now. So once we have taken care of one of the four fragments, now we are left up with a lot of space within the bag. So now it's easier for us to maneuver the posterior plate much more anteriorly. Chamber is filled with OVD, and the goal is to break the bridge which is holding these three fragments together. And how are you going to do it? Now the chamber is now maintained with OVD. Using a Sinskey hook, I'm going to maneuver the posterior plate anteriorly. So what this does is basically it gives me an easy access to emulsify this bridge which is holding all these three fragments. This is what I call as a fake of the base. You're getting the base up, and rather than struggling to do the lateral separation within the bag, and there's always a risk of being too close to the posterior capsule. So what I'm doing is using a Sinskey hook, I'm maneuvering this posterior plate much more anteriorly. OVD is pushed underneath it so that the plate comes under direct exposure. So now the situation is the nuclear fragments have flipped and the posterior plate is much more anterior and it's at the level of the pupillar plane. So what I'm going to do is I'm just going to go in, use sculpt setting which has got very low flow rate, and just using the ultrasound energy to eat up this small bridge which is holding the three fragments together. It's a very simple way and extremely stress-free to deal with this thick and adherent posterior plate. So this is what I call as the flip the base and phaco it. So with great ease, we could separate these three fragments. The only catch in this is that you have to have enough space within the bag to flip up the posterior plate. And this is possible only if we have somehow managed to emulsify one of the fragments. One of the three fragments is now pulled out of the bag and then being emulsified. You can always watch my chopper is just held above it so that the fragments coming out of it won't fly out and hit the corneal endothelium. Now the remaining two fragments again are pulled out of the bag one by one and emulsified in a very controlled manner. So last bit of a fragment is again pulled out and it's emulsified. This was the highlight of the case. The remaining steps would be normal. The cortex is aspirated out, the chamber is inflated with OVD, the lens is placed into the bag, the OVD both in front and behind the lens is irrigated out, the side ports are titrated. Now the lens is aligned finally into the intended axis. That's it, the case is done. So thank you for watching and hope you found this helpful.